Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to go over how to properly and effectively elevate the leg for management of swelling after knee replacement surgery. So before we jump into it, be sure to hit that subscribe button below if you're interested in catching all videos related to knee replacement surgery, rehab and recovery, exercises, frequently asked questions, and everything else in between. So when it comes to elevation after knee replacement surgery or any type of surgery to the lower extremities, to the legs, there's a couple things that people tend to make mistakes with. So the first thing is trying to just elevate the legs by putting their feet up on a recliner chair. And the thing is, this usually isn't very effective because for effective management of that swelling and for that fluid to move out of the legs through gravity, bringing it down out of the legs, you have to get the legs above the level of the heart, and you have to get them high enough. So what I mean by that is you have to get a certain amount of flexion or bending in your knee so that the leg is high enough to get those benefits. So what some of the research and the literature shows out there is you need to get at least 30 degrees, 45 degrees of bend or flexion of your hip when the leg is up straight to start to get those benefits of elevation. And really, ideally, it's even better if you can get up higher to that 60 or even 90, close to 90 degree level is where you'll really get the most benefits. So what can we do for this is we want to really just stack the leg up as high as we can. You want to lay down flat. That's going to get so your heart is kind of at the lowest level you can possibly get it, really. So laying down flat in bed or laying down flat on a couch, and then you really just want to stack the leg up. And for the vast majority of people, it's going to be higher than you even think is, when you think it's high enough, add a little bit more, because for the most people, it's not up high enough to get the real true benefits of it all. So you can use all sorts of things. You can use pillows, of course, is probably the most common. You can use sofa cushions. You can use wedges. There's a lot of great wedges out there that you can use. You can use a physio ball sometimes is great. Whatever you have available. So most likely you have a lot of pillows. So I'm, going to bring all these pillows in. So you have these big couch pillows. I have your normal pillows that you use for your head. And you just, try to be creative. And actually I'll do, you're going to play around with it and get the angle that works for you and that's comfortable for you. And you'll see here as I lay down, even there, with 4 different pillows stacked up, I don't really, maybe I'm at 30 degrees, I'm probably not even to 30 degrees of flexion of the hip joint. This is that angle we're talking about where we want to get at least 30 to 45 degrees. So I probably could even add another pillow on top of this. Or what I could do is fold the pillow over. And like I was saying, when you think have the leg up high enough, add another pillow probably, because you probably don't. So that looks a little better. That might be getting to that 30-degree angle by then. So that's the big thing, getting the leg up high enough, getting above the level of the heart. Now, can the knee be bent or should it be completely straight? That's a thing that's kind of hotly debated in the PT world. So from what I understand is if you have some bend, if you have some flexion to the knee, that's not the end of the world. And actually early on after surgery, within the first 48 hours or so, it might have some benefits in terms of reducing blood loss, reducing stiffness and swelling. Now, we do want to try to emphasize knee extension and knee straightening because that's really important for your long-term outcomes and effectiveness of your surgery. So we don't necessarily want you to just have the knee bent very severely, very significantly, especially if that's the position you're going to be in for the majority of the night. So what I always encourage people and tell people is you're going to want to have a tiny bit of bend. It's just going to be more tolerable, more comfortable, more practical, but don't overdo it. You know, try to keep the leg relatively straight as best you can, but a little bit of bend isn't necessarily the end of the world. A couple other things is you can have what I call add-ons. So when you're elevating the leg, you can do some other things with it to help get some benefits. So for example, you could use compression, so either through a compression stocking or a compression wrap to help with the fluid and the swelling even more. You can do massage, either yourself with a massage stick or a lacrosse ball, or your hands, or someone else, or a friend or a partner can massage it, or a therapist. You can do some active exercises. You can do ankle pumps up and down. You can even do some heel slides, some gentle bending, straightening, quad sets, contracting that quadricep muscle on and off. So there's a lot of different things that you can do there. You don't necessarily have to just lay there and do nothing. So those are my key tips and the important things when it comes to managing swelling after knee replacement surgery and getting the full benefits of elevation and elevating the knee and elevating the leg after knee replacement surgery. I hope you found this helpful. Be sure to leave your comments and questions below. And again, be sure to hit that subscribe button if you're interested in catching more videos like this, sharing frequently asked questions, exercises, and everything else in between when it comes to your knee replacement surgery.